What's up guys, this is Dr. O from Innovative Dental and pleasure to have you here today. Man, I hope you're smiling. Keep smiling, right? Anybody like that cheesy line I give at the end? No? Stupid? Okay, well, I'll have to rethink it because I kind of liked it. Dang it. Hope you're tuned in and gonna listen a little bit and learn about dentistry because I'm super passionate about it. Hopefully you can get that from the video. We're gonna talk about why you shouldn't crown your front teeth, and I'm gonna give you a clinical example. My first video I created was do not crown your teeth, and I explained why front teeth hardly ever need crowns. There's a lot of questions from that. Even some dentists have some questions of why that's my thought and questioning my reasoning behind creating the video, and I wanna help bring some clarity to that. So I'm gonna use a clinical example, and then after that, I'm gonna give you maybe 3 or 4 reasons why a crown may be necessary on your front teeth. So you can maybe go, okay, those are really the 3 or 4 that I might need a crown. First, let's look at this clinical example. I wanna use this one because it's pretty impressive, right? You look at this and you look at that photo and you go, man, that looks like extractions, right? Can we even save those teeth? Probably gonna need some root canals, definitely gonna need some crowns, maybe even extractions if they're even savable. And if you look what we did here, we went ahead and first let's remove all the decay. So in this photo you'll see decay is removed. We wanna just see what the tooth structure is left after decay is gone. And you'll notice we didn't get into any of the nerves. So all of the nerves were healthy and vital. No root canals were needed here. So pretty cool, right? Save the guy, let's say four root canals, $4,000 roughly in our area. Next, you'll see that we restored the teeth with composite. So we reshaped the tooth structure so that a way a veneer could be created and bonded to the tooth. And so you'll see we reshape it. By the way, the blue dye that you see is purely to show any amount of decay that's left on the tooth, and we use that to make certain we get everything. We don't want to leave any decay behind. One of the cheesy sayings I love is no bugs left behind. That's kind of dumb. No bugs left. You get it, bacteria or bugs, no bugs left. It's stupid. All right. Well, anyway, so we definitely don't want to leave any decay. Then we build it back up, and then we image with our machine and create, and you can see some of the machines behind me here. Those are CEREC machines. Those allow us to image in our office and create veneers right in our practice, single visit. So this smile was completed in under 4 hours without any root canals, all veneers. And matter of fact, if you would have crowned these teeth, there's no way you could have saved them. And the reason you couldn't have saved them is because you would have cut all the enamel off the back and you would have had hardly any tooth structure left after crowning these teeth. Many dentists would maybe want to take and do root canals electively and put pins inside the tooth. We chose not to do that because I feel like teeth are healthier when they don't have these pins inside of them. I feel like they're stronger, gonna last longer. By the way, this treatment, I know there might be some that go, well, how long does that last? Did you do that last week? This guy I fixed this smile 5 years ago. So this is a smile 5 years ago, still smiling today, comes in, awesome guy. Here's a before of his smile and kind of how he looked and his confidence, and then look at him now. And yeah, that chubby guy next to him is me. So, but that was 5 years ago after we fixed his smile. Pretty fun to share that story. Hopefully that clinical example helps you go, aha, I understand what you mean when you say teeth don't really need crowns, in the front at least. There's a lot of benefit to a veneer. We save all that enamel. And if you want more on that, definitely go to the video link here. I'll probably put it right here, and link to that and watch the video of how I explain why crowns are probably not necessary for you on your front teeth. Now let's get to the 4 reasons why you may want to crown your front teeth. So these are the exceptions to that rule. The first one would be an existing crown. I started realizing that, man, hardly any teeth, I don't crown hardly anything unless it's an existing crown I'm repairing. So, you know, existing crowns, you have to crown them. The damage has already been done. The amount of tooth structure has already been removed, or the decay is already so much that the crown was necessary to begin with, and so a crown is necessary to replace it. You can't go backwards, right? You can't do a crown and then go back to a veneer. So once it's crowned, it needs to be crowned again. The other one would be a root canal. If you had a root canal and it's quite a bit of decay and it needs a crown or something to cover up the decay, I might wrap around and cover the access. On the back side of the tooth, there might be a little hole where the root canal is performed. I would cover that with the crown. I would not grind all the way down to the gum line though, like a traditional crown, which is really just more tooth removal than necessary. So that's how I would treat a root canal tooth. The other one would be severe decay, but man, it's hard to have decay that actually goes around the backside of the tooth. It just doesn't happen very often. Every once in a while you'll see it if somebody has like an enamel defect or a groove in the backside of the tooth and it's pretty significant decay. At that point, definitely crowning would be a good option for that patient in that scenario. The other one I had somebody ask me is, I had some questions like a chipped tooth, right? What do you do with a chipped tooth? I can't see any reason why a chipped tooth should ever need a crown. That's a really common mistake, maybe I would say, in diagnosing chipped teeth, veneers, or just resin fillings. If the fillings keep failing, which in this gentleman's story, that's what was happening with him, I recommended, I said, hey, you gotta encourage the dentist to maybe be able to do a veneer for you rather than a crown if you just keep having a filling that's chipping. That way you save more of your tooth structure. The other example would be severe wear. Now, if you have severe wear and your teeth have kept wearing each other down like this, then what's happening is over time, you're filing down the backside of your top teeth. If you go and crown those teeth, you're gonna have to remove the amount of porcelain thickness from the backside of your top teeth. So crowning initially would be a mistake and not a good recommendation for tooth wear. So you don't wanna crown initially. What you wanna do is you wanna use some sort of technique, whether it's Invisalign or braces, to create separation, so create space. So we wanna take what's no space and what's ground away into your tooth, create some space. Now we can rebuild the tooth structure there. And I can make a video that maybe helps better clarify that, but don't go in with tons of tooth wear and expect to get crowns unless they're gonna open the bite and change the vertical dimension. Otherwise, you're getting too much grinding into a tooth that's already worn. What that is likely to do is actually lead to a root canal or tooth pain from the fact that you just drilled so far into the tooth that was already worn away by your lower teeth. So tooth wear, definitely gonna need a crown maybe down the road, but create the separation first with maybe like Invisalign or braces, then choose to crown the tooth. All right, so hopefully that helps with a clinical example of why you should not crown your front teeth and showing you that, hey, look, we can take a smile that almost looks like dentures and we can restore it with technology that is readily available and techniques that don't require so much removal of the tooth structure. And then I gave you the 4 reasons why you wanna maybe consider a crown if it's necessary. One being that you have a existing crown, the other one being that there might be a root canal, the third being that there's severe decay that covers the backside of the surface, and then the fourth one would be severe wear after you get some sort of alignment or separation created from braces, maybe Invisalign, before you would then have those teeth crowned so they're fixed and not have to be ground into like they would if you didn't get that separation done. So I hope that helps make sense of a video that seems to get a lot of attention and hopefully is helping people understand stuff. So obviously the whole point of the channel is to take what I feel has been not a lot of innovation in the way that we've done things in dentistry and helping to think through why we do what we do and provide the latest for our patients. And so one of those would be rethinking and retooling our brain to go, we should be conservative and let's save as much tooth structure as possible and let's make things last longer for our patients rather than being so aggressive with the handpiece. So hopefully you like this video, makes sense. And you know what, if you stuck around till now and you found this useful, definitely I'll give you a second, hit the subscribe button, like it, share it with your friends, and it would be helpful to them. Obviously, I would love, and our team would absolutely love to see you at Innovative Dental. If you would love to make the trip or thought about it, don't hesitate to check out our Smiles Within Reach program. You can give us a call at 889-4746. Also, you can head over to idspringfield.com and you can learn more there. I look forward to seeing you guys in the next video. And you know what? You have an awesome day and keep smiling.